Hey everyone, welcome to Inspiration with Manda J. And today I'm really excited to meet and introduce you to my new friend Milou, or Milky. What do we call you? What does everyone call you? You're about to make 53,000 new friends.
Yeah, well, just Milou will be fine. Just Milou will be fine. Nice
So
to meet you
Milou
too.
and I just met yesterday or the day before online, and we've met because she's a nurse, and
Yeah.
it's such good timing. Some of you who follow me would have seen a post I did yesterday about the Bahamas hurricanes. I know you're all aware about the Bahamas hurricanes, and as many of you know, as well as being an inspirational therapist or whatever you call me, influencer for inspiration, I work with medical support offshore. I do most of your ship captain's medical training or medical care on board ships. We provide 24/7 support to boats all over the world, like and help and train up the guys from the Volvo Ocean Race, the America's Cup, the Golden Globe, etc. And at times like this, we do as much as we can to help with hurricane relief. So the guys in our US office, Becky and John, have been working with Yacht Aid and MB Pacific Hope to get as many supplies as we can down there. It sounds quite morbid, but it's the truth we must speak. I know on Friday, Becky, my colleague, was working tirelessly to find 2,000 body bags to get down there. And we're doing as much as we can. If anyone's got medical supplies that are out of date, or bags for medical supplies, body bags, anything you can provide, hit any of us up at Medical Support Offshore, and we will find a way to get them over to the Bahamas. But then I met Milou, and Milou's just arrived in Mallorca. She's a registered nurse, and lo and behold, she's just basically finished years of a big campaign, as far as I know, working with the guys that were devastated by Hurricane Irma. And
Yeah.
so it was such good timing that I could get her on board today on the show and find out from someone that's been there on the ground. I've got goosebumps just talking about it. What goes on, what happens, and how, what's really going on behind the scenes while we're all just posting videos of hurricanes and asking for people to send money to Pacific Hope and Yacht Aid and all those amazing charities, and people that so many people want to help and we don't know what to do. So first of all, tell us about yourself. Where are you from? What do you do? Why are you here?
Thank you, Manda. Thank you, Manda. Well, just as you said, I really love how you guys are been working on sending help to the Bahamas, as Hurricane Dorian has destroyed a lot of it. Well, I've in 2015 I've moved to Aruba to work in the hospital there, as I got sent it to St. Martin as Hurricane Irma just completely destroyed the island over there. And as you said, just being in there and seeing how it affects the locals, yeah, it's horrible. And once the 7 years the hurricanes come up again, and it completely destroys the island again. So while they're rebuilding and actually a little bit rebuild, then the next hurricane come again, and it will completely destroy it again. And it's horrible for the people. So sending lots of love to the Bahamas, of course. And as the I just heard that the food supplies are there, and water is there, the medical care is really needed over there. And as 3,500 people got evacuated to the big city, there's still a lot of people in the bad zone of the Bahamas. And it's really hard to get to them. And my heart and my mind is really, really by all those people, because it's horrible what they're going through now.
And
Yeah.
as a nurse on the ground, it must be kind of horrible as well. Like, where do you even start when you've already got limited resources? Possibly, the hospitals have been wiped out.
Yeah.
Where do you start? Like, what were you doing? How did you get?
Well, For me, when I get down on the ground there, the first thing you do is just evacuate the pregnant people to the nearby hospital, the children, and after that you can start evacuating the rest of the people. Um, it's really hard for them to leave their houses, although there are still family members missing, and it just breaks your heart to be there. It just really breaks your heart, and I was really happy to help with every little thing that I can do over there, like flying out the patients to a better environment. Um, yeah, what can I say about it? It's just really horrible for the people what they're going through, and I'm really happy to being able to help a little.
And so when you were there, did you have to set up an A tent and start triaging people like we do in hospitals and working out who's got what and where do they go?
Well, actually, that was onto other people. Really, my position was at the helicopter to fly out the patients and to guide them to the new hospital, to a better situation at that point.
Right, and I
Yeah.
know from personal experience, having lived in the BVIs for a long time, I know there was when I was in the BVIs, there was one helicopter service that a really good friend of mine, Brad, ran. But I know we've had like accidents on Necker Island and places like that, and trying to evacuate people is very hard when there's limited resources there, especially post hurricane. So who provided the helicopter in the first place, and who was funding it, and where was everyone going in your situation?
In my situation, the company I work for called Health, she was funding it, and as the resources on the island, they put on the tents, and I actually don't know who was funding that side, but for me, my company was funding me to being able to help the people. So I'm sending thanks to Health. Yeah.
Amazing. So that'd be really good if you could put the link to that organisation below this chat as well. And the next thing I'd like to know is, what are the main problems with illness and injury? What were some of the, I know in yachting it's actually quite hard to get statistics in yachting because we deal with the rich and famous, and every time I go to a boat, which is every day, I'm absolutely shocked with the stories I hear, and we don't actually have a lot of our injuries in statistics and documented, except for the different, companies who are obviously charting everything that goes on. So what, do you have numbers like what? So for example, in yachting, one of our biggest problems is eyes, ears, nose and throat, then gastro, then it would be crush injuries. How would you say, what were the big injuries and illnesses that were happening due to the hurricanes?
Yeah, it's really different injuries as they've been hit by different sides of the hurricane. My opinion, what comes from it is really a big problem, because as St. Martin got destroyed, after that people start robbing the stores, robbing each other, stealing things on the island, and things just got really violent. And in my opinion, that's the biggest problem after they got hit, just to put more police support, more securities, because people are just scared, and they have running out supplies, so they just gonna steal and rob each other. And in my opinion, that's a really big problem, as the rest is already taken care of with medical care.
Yeah, I noticed. I was in the BVIs during after Marilyn and Louise, and over in St John's, and just the people going back and forth to the Kmart and walking with TVs, and meanwhile there's grand pianos,
Crazy. It's
trees. It was
crazy.
crazy. What about things like waterborne illness, dysentery, cholera, mosquito-borne illnesses? Are they going to be a big problem because the lack of services available and the stagnant water and etc.?
Yeah. Well, the main problem is is like the basic health care. So they won't really look at those kind of things. The main problem is to take in the injuries, and treat them as well as they can as they have the supplies. So um, I really can't say a number about that.
No,
About the
sure.
No, no, no. Sorry. Yeah.
And if we're getting together medical supplies, what were the things you guys really needed over there last time? Because I know when we all start, when we had floods in Mallorca here a few years ago, they had to start turning away people to help and supplies because they were a bit overwhelmed. And if people were getting us together bags ready, what
Yeah.
were some things you really needed and some things that you couldn't use?
Well, the bandages, the IVs, um, antibiotics, the tetanus shots. Those were the main things that needed to be on the spot. Um, and everything was what was after that. We fly them out to the hospital and just to get them good care over there.
Where were you flying them to? Which hospital, may I ask?
To Aruba, actually, to Aruba. The people from Stasia, Sint Maarten, and Saba, and the other little islands, we flew them out to Aruba.
Mm-hmm.
Yeah.
And what was, I don't know, it seems a weird question to ask, but what was one of your most exciting times over there when you just felt really fulfilled?
My most exciting time was, I guess, the 3 months on Stasia, because it's this little hospital with 14 beds. It has no windows. It is really like a third world country. And just to being able to give them some clinical lessons for better healthcare, and they were really appreciating it. And the people had no money, they have nothing, but they have lots of love, and they're so nice. And it just glowed my heart, and I think that was the best experience I ever had.
And what was your accommodation like? Where were you sleeping? I know when I've done aid work before, I've been in dongas, which are containers, or tents with our colleagues. What was your accommodation and food and water like for you?
Well, my accommodation was actually a wooden hut.
Mm-hmm.
And I also needed to get water from a tank. And if I wanted to do my laundry, I needed to fill it up with a bucket of water myself. So experiencing that was, yeah, I'm speechless. I have no words for that. Like, wow, that the people are still living like that. And yeah, to experience it and to live in the middle of it. And yeah, that was the best experience, definitely.
And were
Yeah.
you just getting completely eaten by mosquitoes, or did you have enough protection from that?
Well, I drink a lot of lemon water, then my blood becomes sour, so the mosquitoes won't like me to bite me.
Ah,
Yeah.
okay. So they
So my
need lemon.
advice is just put a lot of lemon in your water, drink it 1 or 2 liters, and the mosquitoes won't like you.
Amazing. And
Yeah.
so I've heard at the moment the thing they need most, obviously cash is normally king, but medical supplies. Something else that I'm fascinated in, as many of you know, I'm really interested in water. And I was wondering if we could get some money together for some water filtration over there, or is that going to be sorted out by the aid workers and the existing services there? Is that something they're prepared for, and that they already have like reverse osmosis units and water maker waters from salt water, to go straight in there? Or how were you filtering your water when you were there? How does that work?
Well, the water was still there. The point was the electricity.
Right.
And as I did some research this morning, the Bahamas also still has water, but the electricity really is a problem.
Yeah, and that's going to be huge in the
Yeah.
hospitals as well, isn't it? The ones that are standing.
It is. And as they running out, and also on the yeah, they really need to go to another island for that. Yeah,
Yeah, sure.
that's the biggest problem.
Um, so let's talk about you a little bit. So you ended up in the Caribbean a few years ago doing this crazy work, and it sounds like you were there for quite a long time. What were
For
you doing before that? How did you get qualified to be able to go and help in and work so independently in a crisis? You know, which is obviously a strength of character you've got from past experience. So
yeah.
where did you get that from?
Where I got that from? Well, I started off working in a universal hospital up in Holland in the north called UMCG. And in the utility there, we had, just like you said, for the Bahamas, the things we don't need, we were sending them to Aruba. So I started Googling and I was like, I actually do like this. And after 3 years working in that hospital, I apply on a job in Aruba. And they were actually really happy because they thought, yeah, we have an experienced nurse. As I got my anesthesia masterclass, I'm a professional in putting IVs. So it took up to 2 months and I was already in Aruba. And as I got a recovery experience, I also worked on the endoscopy rooms. And yeah, I worked there for a couple of years. And just to see it, it was, it was a third world country. And after 2 years ago, they built a new hospital now in Aruba,
Mhm.
and this is a really good one. It comes up to the Dutch criticisms, and it's a really awesome hospital they have built there now. Yeah,
Fantastic. And
yeah,
so in nursing, you get quite a lot of skill set. So you've got your anesthetics, you've
I do.
done recovery, which means that in Australia, when you've got anesthetics and recovery, you're also qualified for emergency. Have you done time in emergency as well?
True, true. Yeah, I've been on the emergency rooms, responsible nurse actually, on the emergency rooms in Stasia and in Saba.
Oh, wow. And what was your favorite part about that? Were you doing resus or trauma or anesthetics or in charge or
Um, as
all of the
their emergency rooms, we just receive everything. My most thankful experience was the little children, as in the Caribbean, a lot of little children get born with asthmatic problems. And so basically, I was doing children care, I was doing the trauma care. Um, and just be responsible for flying out those patients to other hospitals who had big accidents or stuff like that. Although I must say, yeah, the children care really glowed my heart. Yeah, because I never did that in Holland, and to experience that and to add that on my resume, that was, yeah, it's really awesome to work with kids, little kids
Yeah,
like
it's
that.
very special, isn't it? Because you know, for those of you that are listening that don't know, is kids are quite different to adults, aren't they? Like
They are.
they, their bodies are different, their needs are different. They spring back and forth quickly.
Everything is different. Everything is different. Medication, the CPRs, the heart rate, everything is different for children. So that was a really good experience for me and a really
That's
grateful experience. Yeah.
fantastic. And so
Yeah.
now you're in Mallorca.
I'm in Palma.
Yay! What's the
Yay.
plan?
Sorry?
What's the plan? I believe you've just done your ENG one.
I did, and I'm in good health, thank God. Well, I didn't expect everything different though. My STWC is on the 16th of September, and I'm trying to get a medical position or as a stool nurse or as I after 10 years working in the hospital, I needed something different. Yeah, that's why I made the choice to go on a boat. And I found myself in a position, well, I just come back from my dialysis education. I was the last year I was in Holland, and I found myself dragging myself to work because I was already used on living different spaces of the world, and just to be stuck in this one place made me really unhappy. So that's what made me go move to Palma and to make this career switch.
That is amazing. I'm sure there's so many people out there ready to snap you up. I must admit,
I
I
hope
am
so.
constantly asked to work on boats, and if I can go back to Australia, because I go back and do my 2 or 3 months practice a year, and I've always got the captains and chief stews asking me to bring back a few nurses. So hopefully we'll find you a job from this interview as well, because I would
Hopefully.
certainly like to have you on my boat. You know, having someone that works independently, that can cannulate and get IVs in, because obviously at sea we have a lot of problems with dehydration and seasickness. So it's quite a skill to be able to get the IVs in. We have bone guns as well, which we try not to use unless someone's dying. So, you know, I think it's not too long before every vessel has to have a medical professional, be it a paramedic or a registered nurse,
Sure.
and so many as well want
Yeah.
people and need people with trauma experience, because nursing's, you know, so
And
so
it's
vast.
really important. It's also really important to have those people on board, I guess. Yeah.
Can you tell me one of your funniest nursing stories ever? I know I'm putting you on the spot here, but has
One
it?
of my funniest nursing stories, well, actually, I can tell you a bit about my scariest nursing story. In my night shift, as
Oh,
we maybe all know as nurses, that the dementia elder like to walk around in the middle of the night and just stand behind you when you don't expect it. As she pulled out her catheter, and there was this blood running out, and I looked behind me and she was standing there with this hole, and I was like, that was like my scariest experience ever. So since then, in my night shifts, I'm always doing extra rounds. Yeah.
oh my God, I know. I was so scared of someone.
Yeah.
Okay, so I'm just going to apologise. You've got two nurses that have just met that are bonding on international yachting radio.
Yeah, so
Yeah,
sorry.
night nurse is so scary, because your biggest fear is that you're going to find someone dead, but you
Yeah.
also you don't want to wake the
Well,
patient.
I also have experienced that, and it's not a nice experience.
Yeah, it's
Yeah.
it's tough. Um, and yeah, that's why people need lots of checks. And that's a tricky one, actually. Like, there was a situation the other day that I was talking to some friends, and you know, they were saying that their boss, who they've worked for years and years and years, and he woke up. He always wakes up at 7 in the morning and does his exercise. And he travelled along, you know, done a long haul flight to get to the boat, and 7 o'clock came, he didn't get up. Breakfast was waiting, the table was set, you know, the guys were ready to go. 8 o'clock came, he didn't get up. 9 o'clock, 10 o'clock. And then they were like, at what point do we invade his privacy? Because in a hospital, we can just open the door and storm on in, and you know, check their, and we've got, you know, equipment to check their breathing and see if they're alive. We can sneak a little pulse oximeter on someone's finger, right? That they were like, well, at what point do we walk in someone's room and see if they're, you know, the boss is breathing?
Yeah.
11 o'clock came, 12 o'clock came, and they're like, what if he's dead? What are we going to do? And then what
Yeah.
about the negligence that we didn't check him for all these hours? And anyway, he ended up stumbling out of his room at 12, and he'd had he'd actually taken an antihistamine, which, as we all know, can make you really, really drowsy. But
Yeah.
didn't expect it to give him such a big sleep. And I just thought, isn't that an interesting discussion to have on boats? Because at what point do we cross that line and go and like knock on the door and say, "Are you alive in there?" You know.
True, true, true. Well, yeah, from my experience, just knock on that door and just check.
I think so. true. Now,
Yeah.
what's another good story, like when you have your heart, like for me, I am so grateful that I grew up with a career in nursing. I actually believe that everyone should do, you know how they do military service in some countries? I think we should do hospital service. I think everyone should do a night shift on an aged ward. I think everyone should spend a few days in a wheelchair, being
Yeah.
put in a hoist, lying in bed, and having to go to the toilet lying down with a horrible pan coming in under your bum,
Yeah. Yeah.
having to be
Exactly.
bed bath, having to be fed, to just understand what
It
we
is.
and what we have to live without when even our wrist and arm is broken and we're all our legs aren't working, we're in hospital. So what are the times when you've been holding someone's hand when you just go, I'm so grateful for this lesson in life?
Oh, I had so many of those experiences in these last 10 years. So it's really hard to point one thing. Well, one thing pops up in my mind, and it was like in the beginning, in the first 2 years when I was a student nurse, there was this woman with breast cancer. She was 31 years old, and it is there was actually a movie made about this, and about a similar situation. Her husband, he couldn't drag the situation, so he was not showing up at the hospital, and it really broke her heart. And because he had such a tough time of seeing her going backwards of the chemos. And in my coffee break, I just decided to go to her and to say chop on, and I just lay next to her in bed and just talk a little bit with her. And that meant so much to her that a few days later, when I arrived at work, she left this little tissue for me where she wanted to thank me. And she already passed away in the days before, but she left that for me. And that, to have that, I still have it on my wall, that little tissue. To do that to people, yeah, everybody should do it. Everybody should do it and give that kind of love and just make that little bit difference, not just to be a nurse, but also to be a friend and to guide them and just to do it with all of your heart.
That's
Yeah,
amazing.
yeah,
So beautiful. And
yeah.
how do you think you'd feel? Because you're an incredibly qualified nurse. I mean, as highly qualified as they come, really. How would you feel about being on a boat? And I'm kind of turning this into an interview, a public interview. How would you feel though? Because one of the problems I have when I bring nurses over from Australia to work on the boats is, they're ICU, they're emergency trained, they've done 10 years at university with all their postgrads and all the points we have to gather and the education we have to do. They have this dream life of working on a boat, and they think they're going to be in a little boat hospital dealing with crew injuries, but they end up in the laundry for the first couple of years doing laundry and dealing with the odd blister, the odd cut, the odd bit of seasickness, and probably won't touch a cannula except for restocking if all goes well for a few years. How would you adapt to that after having such a fast-paced life?
For myself, you mean?
Yep.
Well, at this point of view, after working 10 years so hard, I won't mind giving myself a little break because of like that. And I think it's a good point of me getting a little bit experience on the boat and also to have a little break of what I've been seeing these past last 10 years. Yeah,
And
so
that's
yeah.
awesome. And
Yeah.
another thing I find really interesting could be a tricky question to ask you, but having been a nurse and a crew member and pro race crew, one thing I've really played with over the years is when I come on board as a nurse and as a medic for when we're racing, it breeds, and another thing we find when we're teaching the medical care on board ships and we're empowering everyone to be mini doctors. How would you feel about, how would you feel like what happens as we start creating a bit of a hospital culture and then we start what starts happening is everyone starts coming to you with their cuts and their sore backs and their injuries. But then when I'm on board as a racer or as a deck stew, I'm just me, and I don't have so many injuries. And so some people tease me and go, when you're on board, we have all these injuries, you're like a bad omen. But actually, I've created a hospital culture. How would you manage that as someone that would probably be employed as a stewardess with the benefit of you being a nurse as well?
I will probably ending up nursing anyway and teaching them how to deal with it, because that's what I've been done for so many years, and that's what I would do. Yeah, just also to give it, to pass it on to
Yeah,
them. Yeah, yeah,
beautiful.
yeah.
And the next thing is how would you cope if you were on a boat in a very remote place? Let's say you're up in Labrador Sound, up in Greenland or Alaska or wherever it is. And you've got an injury on the boat, and it's been a big injury. A couple of people have been injured, and we've got a couple of crush injuries, some cuts, and one person's broken all the ligaments in their leg, one person's broken a femur, and one person's got quite a bad cut, and there's been 2 possible near drownings. How would you manage that situation, knowing that the crew have got some basic more than basic first aid, especially if you've been training with me, but they've got pretty good skills, and your crew are actually more fun, I find, to train and work with than nurses and doctors, because they're very pragmatic, they're very quick thinking, and they're really good at thinking outside the box. But how would you deal with that situation with a multi-trauma in really cold and stormy conditions with no medical backup except the crew?
Well, at first, as a nurse, you just see the injuries, and you see which need the medical care first. I would send the people, or me even, to go there, and I would just say for the rest of the crew what to do or where to go, and to help the needed first, or if they have a big bleeding, or like a broken leg. Yeah, to say it's not the first attention to get to me. A big cut who has big bleedings, that needs my attention first. So I will make in different scales of where do they need me first, and where for the rest to go, and how to go into that situation, and what to do. Yeah, because there's
Beautiful.
always a different kind of level of which people need help first. Yeah,
Yeah, it's always a hard one to judge.
yeah,
Amazing.
yeah.
And one more question. I'm trying to think. How do you think you would cope, having been working in aid work and things, working with the rich and famous, where we see some, there are some boats that have some big parties, there's some movie stars, there's some sex, drugs, and rock and roll, and we have quite a lot of confidentiality, just like we do in hospitals. But how would you cope if, say, you found a guest in the bathroom with some illicit drugs and they were unconscious?
How would I interpret on that?
Yeah,
What I would do in that situation? Well, out of conscience, put an IV, and just get fluids to flush it out of their system. Call the doctor. And yeah, just give them the care they need at that point. I've been seeing these things in the hospital also, so I have experience in it. And when you said about the famous, I also worked in The Hague in Holland, actually in the Koninklijke with the Queen and the Prince. So every person, in my opinion, is the same and needs the same healthcare, either though you're
very
rich or
much.
famous, or you're normal.
Yeah,
Everybody needs the same healthcare, and everybody has the same heart. Yeah.
I love that you say that, because in this world we do forget that sometimes. You know, we treat the bosses and the guests like they're something really special, and we put ourselves last. And it's just so important to remember that everyone is
Every
amazing.
patient of mine gets special treatment. Every patient, even though you're rich or famous or poor. Yeah,
That's very great.
everybody deserves it.
And have you got any questions about yachting and nursing and life at sea?
Well, I'm really curious about the experience, and actually I just want to go. I'm never actually always really scared, as you know, that I love adventures, as you could hear about my experience. So I actually just want to pop on and experience it myself. Yeah, and then after that, maybe the questions pop up. Yeah,
Amazing.
I've been talking to a few members of the boat already, which have fulfilled my questions. So,
Actually, I'm running a course next week. There's the medical first aid and the medical care on board ship. So if you don't get snapped up or end up back on in the Caribbean,
yeah,
you should come in and play with some yachties and see how we teach the remote medicine. It'd be really nice to have you in, and maybe you could do a little talk in there for everyone as well.
I would love to. I would love to. Thanks for inviting me. I already take a note.
Fantastic. Awesome. So I think that's pretty much a wrap. It's probably time to say goodbye.
Yeah,
Thanks to everyone for listening. And Milou, thank you for your sharing and giving us
thanks
a
for having
a
me.
bit of adventure and inspiring us all to just, spend some time to, carry the people of the Bahamas in our hearts. See what bandages and medical supplies we can scrape up. Maybe it's time you're getting ready to do a resupply. Maybe you've got some extra stuff in the container that you don't need anymore. Maybe you just want to send some money. The empty Pacific Hope, Yacht Aid. Do you have anyone you recommend that people can donate to?
Just to all the fundings who help them. I really don't have any kind of name, but I appreciate all the help and everybody who's willing to spend to give some foundations to them and donate some money or medical supplies as they really do need it.
They sure do.
Yeah.
Well, thanks so much for your time. It's been beautiful having you on board. And
Thank
yeah, thanks so much for everyone at Yachting International Radio for having us on here today, and for all you yachties and sailors out there and everyone in Mallorca and around the world listening in. Thanks so much. I'm Manda, and this is Milou, and it's been a great session. Thanks so much.
Thank you too, Manda, and have a nice day. And I'm gonna meet up with you next week.
Can't wait. Look forward to it. Big hug.
Okay. Okay. Bye. Bye.